Welcome back to News 3 Today. School is back in session locally, and Healthy Savannah wants to remind parents and all adults that in addition to your students, your immunization should be updated as well. Dr. Elsie Smalls is the Adult Immunization Program Manager with Healthy Savannah. She joins us now with more. Thank you so much for being here. We have so much to talk about.
Thank you so much for having us.
No problem. First off, let's talk about Healthy Savannah, who you are and what you do.
Healthy Savannah is a local nonprofit, community-based organization, and we do our work is centered around addressing health disparities in Black and Brown communities. Our work is funded by the CDC under the Racial, Ethnic, and Approaches Community Health Grant. We are actually in the second round of receiving that grant. We received the first 5-year grant in 2018, and then in 2023, because of our amazing work and support from the community, we were funded for another 5 years.
Well, congratulations to you for that. So in observance of National Immunization Awareness Month, Healthy Savannah is partnering with the YMCA of Coastal Georgia to highlight the importance of routine vaccinations, especially for adults. We tend to think about children and students going back to school, but adults need to be up to date on their shots as well.
Exactly. We say make it a family affair because, again, as you mentioned, we focus on our students and getting back into the school, but many individuals are not aware that there's actually a schedule of adult immunizations. And that 19 to 64 age, and some people may ask the question, why just that age?
Yes.
Because 19 to 64, again, we're in the middle of our lives. We're doing things, taking care of our children, working in our careers, and we don't, again, realize that as we get into that age range, those immunizations that we got as children have now waned. And there are some specific things that we need to focus on as we grow older.
Okay, so according to the CDC, I was reading this article, only 22% of adults in the country are up to date on their shots. What are you doing to kind of combat that?
We are doing everything we possibly can. One of our main approaches is we have community health advocates, and these are individuals that have partnered with us since 2021. They come from all walks of life, and so they go into their communities to talk about what the pandemic was about, address those fears and concerns that people had back then and are ongoing, and to offer information about the importance and the effectiveness of the vaccine and how it can help our communities as a whole.
Now, you mentioned the pandemic. COVID is still very much a thing. We were talking about this during the break. There's something called a summer bump, right?
Exactly. COVID, again, we're not where we were back in 2021. We're very thankful for that, but COVID still exists. And what happens over time, we have a summer bump and we're going into the fall and we'll probably see another surge, if you will. And what links to that is that over time, the immunization, the shots that you may have gotten 6 months ago, a year ago, it wanes, it weakens. And also as new variants of the virus comes about, then that causes that surge or bump that may occur. And that's why we need to be aware that it's important to keep up to date with our vaccines.
And to help people, both uninsured and underinsured people can still receive these vaccines through a program with the CDC.
Right, and there's one with the CDC, but there's also one with our local health department. The coastal health districts are offering free vaccines, not just for COVID and flu, but about 11 other adult immunizations that's important for our health and well-being over time, and they can be received free at the coastal health district offices.
Let's talk about some of those immunizations. What are they? I know shingles is one. We see the commercials all the time. What are some of the other ones?
Shingles, HPV, pneumonia, DTaP, tetanus, all of those, and there are about 11 others. A total of 14, and includes, of course, COVID and flu. So again, we encourage individuals, number one, to talk to their healthcare professional, their doctors, and find out, again, we go to the doctor, we may go for a specific thing, but ask a question. Do I need some additional immunizations or shots that would be important for me at this age? Over time, our bodies, as we grow older, our immunization lessens. And of course, if we have underlying conditions, that can also lead to our need to have additional help to build up our immunization.
Yeah, you may not want to ask for another shot, but you probably need one.
Exactly.
So a shot that's very important, specifically now, especially now during Tropical Storm Debbie, people are cleaning up, there's water everywhere. The tetanus shot, that's something that a lot of folks forget about, but that's so important right now.
Absolutely. The tetanus shot, again, as you said, and clean up, the water, that's standing water. Unfortunately, if you get a cut or may step on something that you're not aware of, that tetanus shot helps your body to build up immunity against any infections that can occur because of that.
Okay, now you touched on this just a little bit, but you mentioned a grant that you received, and we're talking about the REACH grant. You were awarded this, the CDC awarded the YMCA of Coastal Georgia and Healthy Savannah. Can you elaborate on this grant?
Because the grant, again, the YMCA is our grantee. The funding comes through them. And then, of course, Healthy Savannah is charged with going out in the community and doing the actual work. So under that grant, we work not only in adult immunizations, but we do work around physical activity, we do work around food and nutrition, and we also do work around breastfeeding. So all of those strategies are focused on helping the community to find out more about each of those areas, bring information, create awareness, and also address what has been some historical access issues and understanding and access to education to get that word out to the community. All
right, Dr. Elsie Smalls, thank you so much for joining us today. And we have a shortcut to the Coastal Health District's website on our website. That's at wsav.com/immunizations. Stay with us. You're watching News 3 Today at 11. We'll be right back.